Hello there, and welcome to Health Matters, a presentation by the Ministry of Health. Glad that you're with us on this evening's program, this week's program. My name is Nazim Hussein. Recently, the Guyana Human Organ and Tissue Transplant Act of 2022 was assented to by His Excellency Dr. Mohammed Irfan Ali, President of the Cooperative Republic of Guyana, on the 26th day of January 2022. Part 2, Schedule 1 of the Act, establishes the Human Organ and Tissue Transplant Agency, HOATTA. The names of the members of that agency were established or published in the Extraordinary Official Gazette of Guyana on the 1st of February of this year. The members of the HOATTA were appointed on the 11th of April of 2023 by the Honorable Minister, Dr. Frank Anthony, for a period of 3 years. The agency is established to address the need for an organized, efficient, and ethical donation and transplantation program here in Guyana. Joining me in our program today, I've got the Chief Medical Officer of the Ministry of Health, Dr. Narayan Singh, and he'll be telling us and guiding us a bit about something which is relatively new, not to the Ministry and the health sector, but to us as members of the public here in Guyana. Welcome to our program, Dr. Singh. So tell us, the President assented to this act, and systems are put in place. But transplants were done before the act went into place. But for the general public, what is human organ tissue transplant?
So this bill or this act that has been assented to, prior to 2022, Guyana was doing transplant, mainly kidney transplant and corneal transplant, but it was done under there was no legislative framework on which it was done. And over the years, we realized that the need for more transplants is increasing. Prior to this, all transplant was basically done, especially kidney transplant, were done from living donors. And that was private arrangement between a relative or someone who donated an organ to the person who needed the transplant. We realized that the need for organ transplant is increasing, and the pool from which we can get organs from is actually a small pool, mainly relatives or some close relatives who would donate that organ. So the need for having more organs available for these persons who need organ transplant is there. And one of the sources is from deceased donors, persons who have been declared dead. We can harvest those organs and transplant them into persons who need them. This is relatively new in Guyana because it's never been done before, but it's been done in other countries around the world. But in order to do this, we need to put the legislative framework, put the necessary systems in place so that it can be done in a equitable and also and ensure that it is done ensure that no laws is broken and no persons is coerced into donating organs and to remove all those necessary things that can happen in terms of people buying organs and so on. So this act actually caters for those things. And so the agency, the HOTA, which we as established, is tasked with ensuring that all these frameworks, all these regulatory mechanisms are in place before we can start harvesting organs from deceased donors. This is new to the population because many people, it's new, and then we wanted people, in order to have harvesting organs from deceased donors, we need their consent. Consent can be given before the person actually died. Some people can actually say before that, I want to donate my organs in case I died. Or even at the time of when they're declared brain dead, the relatives can actually consent to donation of these organs. Again, this is a process that need to be have some rigorous control mechanism in place so that persons don't just go and harvest organs from deceased persons. And so we need a consent from the relatives or from the person himself before they die so that we can harvest the organs. That is presently going in, taking in place, but we need the population to be educated because, as I mentioned before, this is a new process in Guyana, and we wanted to person to be aware that this is now one of the things that we'll be offering to persons who might be clinically brain dead, to relatives and to persons who want to donate in the future, that we can harvest their organs for use in other patients who need their organs.
Right, thank you, Dr. Narayan, for an opening segment of talking about this agency that was recently established earlier this year. Stay with us. When we come back, we'll be having a further discussion on organ and tissue transplant.
In 10 minutes, you could save 3 lives with just 1 unit of blood. Here's how. Each unit you donate is divided into the 3 components: red blood cells, plasma, and platelets. Each of these components have different uses too, treating different diseases, car accidents and burn victims, trauma patients, open heart surgeries, and so much more. Car accident victims and organ transplants require at least 50 units of blood. Burn victims need at least 20 units. Open heart surgeries require at least 10 units of blood. It starts with you and 1 single unit. So let's join in making the world a better place. 1 pint at a time, 1 life at a time.
Millions of people live with or are predisposed to type 1, type 2, and gestational diabetes worldwide. If you have diabetes, eating well, exercising, taking your medication, educating yourself on this condition, and knowing and managing your numbers can guarantee a healthy and fulfilling life, and delay or prevent serious health complications like heart disease, blindness, and kidney failure. Persons with diabetes should aim for a blood sugar level between 80 to 130 milligrams per deciliter before meals and less than 180 milligrams per deciliter 1 to 2 hours after meals. For anyone predisposed to diabetes, adopting healthy lifestyles is the key to delaying this disease's progression. That means eating well, exercising, maintaining a healthy weight, and getting screened regularly. If you are unwell, have high numbers, or want to learn more about this condition, visit your nearest health center. You can lead healthier and longer lives with our intervention and your adherence. A message from the Ministry of Health.
Welcome back to our program. So, Dr. Ryan, the bill was passed, and this sort of members of the monitoring committee or members of the agency, they were selected by the minister. What happened since that the minister, and since the bill was passed and the minister put the individuals in place? What happened since then?
So presently, the agency which is responsible for organ transplant has been started doing some work. Mm-hmm. One of the things we are presently putting in place the systems that are needed for these the organ transplant to start happening. First, we are building some capacity locally. Mm-hmm. We know we have like a transplant team, but also the team will need another team for harvesting of the organs.
And that was the last question. People want to say, but do we have people who here in Guyana who can do it? Because you have heard stories in the past. Well, some doctors will come and spend 2 weeks here and do stuff. Do we have local capacity of human resources?
Yeah, we got it. As I mentioned before, transplant has been taking place in Guyana before. Excellent. And we have a local transplant surgeon, Dr. Kishore Prasad, who's the leading transplant surgeon in Guyana, and he has a team of doctors with him. We are presently building on that team because we realized once this thing started, we will need more transplant team. Mm-hmm. And so presently we have some doctors who have been identified to actually be given further training in transplant and also harvesting of organs. We have collaborated with an international agency called DTI, Donor and Transplant Institute from Spain, and they are providing some technical support and training for our team, local team, so that we can build other teams in harvesting and also the transplant surgery. So presently we have 2 of our doctors who are presently in Spain, looking at getting some enhanced experience on harvesting of organs from deceased donors. When that team come back, they will actually train local physicians here so that we can build the capacity, because once we start the program rolling out, we know that the demand will be great from the teams, and so one team might not be adequate enough. So we want to build more capacity. So that's in capacity to do the thing. We are also building capacity in the systems, putting the systems in place, like the registers for persons who are going to be on a register, who gets on the register, how they get on the register. And so DTI is providing that technical support to us to how persons get onto the register and before you can qualify as a receiver of an organ, and make sure that it is well done in an equitable way and ensure that all the ethical practices are taken care of. So those are the areas that we are building capacity presently in.
And so the agency will have a sort of a home, an office where people can channel their requests, their registration and so.
Yeah, well, we are working together. One of the things that the agency is tasked with is to certify the facilities that can do transplant surgery. One of the hospital presently is the Georgetown Hospital we are working with, and there are other private facilities that will become on board that will be certified. So the agencies will be the body that will actually give those certification. In terms of
Right, so therefore it's not only Georgetown Hospital, any hospital, but they must follow the protocols, guidelines, and standards set out by the agency.
So any hospital, one of the private hospitals want to come on board, they'll have to satisfy this, these protocols or these checklists. Once they can be given the authority to do organ transplant.
Let's go back a bit. We know that most of the transplants that were done will be kidneys. What are some of the other organs and tissue transplant now that will be, we can see happening?
Other than kidney transplant, we have been doing since 2015 a corneal transplant.
And explain to that, what is that?
Corneal is the front part of the eye that we actually cover with persons who have corneal disease or corneal destruction. They can have a corneal transplant. Presently, we get the corneas from deceased donors through a corneal bank from the United States, which we buy the corneas and then transplant them onto persons. Since 2015 to 2022, we have done almost like 93 corneal transplant. We are hoping in Guyana, or we are working with another agency to actually harvest corneas from our deceased donors here, so we don't have to purchase the corneas from the United States from this agency, and to be able to do more corneal transplant. Blood transfusion is a tissue or the biofluid, and we've been doing that for years. So transplantation at that level, we have bone marrow transplants also can take place, because those are small things that have been happening in the past, but it was never done in a really legal framework. So other than kidney, corneas, we are looking for liver transplants. It's never been done here before, but those are other organs we can harvest. And once the agency is set up, we can, and the things much more all the systems put in place, we'll be able to do other transplants other than kidney and corneas.
Right. Now, basically, this is going to be put in place, but of course in Guyana, it's going to be open to all Guyanese. How would Guyanese now be made aware? Maybe starting with this program, but then at the grassroots, at the common man in the street, how would he be able to, how would he be sensitized as to what will happen and the encouragement for them to come on board? Well,
that's one of the actually main objective or the task of the agency, is to promote sensitization among the population about organ donation, because we need the population to be sensitized enough so that they can willingly donate, or when the time comes or to donate, the consent is already there, the process has been gone through, because we can't wait until the person is almost clinically then approach them and say we want to harvest organs, because it will take a lot of discussion and so on. So sensitization is important, and that we need to start that now, so that the entire population is aware that we can harvest organs and you can donate organs to others in case if that time comes that we need to harvest organs, or you're declared clinically dead and you still have good organs that can donate to others. So that process is where we are now start finding out throughout the country, to ensure that people understand the process. Because we don't want to approach them at the time when we want, you might be a donor, but the person wasn't sensitized before, because you have a limited time from the time the person is clinically dead to time when you can harvest the organs. And if that time is too long, then we can't harvest anymore. And so the sensitization before that they can consent early is important, because it makes it more easier for the team to go in and harvest and then transplant.
People who are on dialysis will be glad to hear this.
Yes, well, that is something, because dialysis is only is not a cure.
No.
But it's only a just a maintenance therapy. And many of our dialysis patients.
So I'm quite sure some
kidney
sensitization
transplant.
will be in this direction.
So we are we now starting with our dialysis patients, informing them that organ transplant is available. You will put on a list once you qualify, and you will put on a waiting list, and then people coming forward to donate organs, or relatives or people signing up and say, okay, that I want to be a donor. Should anything happen to me, I will be willing to donate my organs and so on. So all those systems are now being put in place, but again, we need the population to be sensitized. So when we do approach them, they already know about this topic, and they can easily consent.
Dr. Singh, I know when your two doctors who are in Spain will come back, I'm quite sure they will come on this program because they will have had the skill set, the expertise, the knowledge. But yet I'm quite sure there's a person out there right now who is watching this program and will say, well, the usual, I don't want to go on an operation table. I don't know, if the doctors are knowledgeable and so forth. And so people might be skeptical, as the case may be, when you go in an operation. And sometimes, especially the donor, who doesn't have issues, but now an operation. Given a number of cases that we would have had in Guyana here, how safe, especially from the donor perspective, how safe is that operation, especially giving an organ to someone?
Well, so far, donating organs, you have to be screened. Everybody can donate the organ, because you have to be screened. You have to be in a healthy state. You shouldn't have any kidney disease or any chronic disease that can, that put you at risk. And so we don't take organs from persons who have certain medical conditions and so on. So they have to be screened. Mostly donors we had so far are usually relatives or close relative of the person who needed transplant. We had cases of strangers donating to the persons also, but most are family donors. Then, other than screening and make sure that they want it, ensure that they can donate, there is also the issue of compatibility too, right? Because sometimes you need to do cross-checking and cross-matching of the tissues, ensure that they're compatible. Sometimes cases are where persons actually qualify, they want to donate, but they can't donate because of incompatibility. And so something. But the surgery is really safe. All the donors that we have had so far in Guyana, we still continue to monitor them, not only the recipient, but also the donors. They're monitored in a clinic to ensure that that they don't develop any complications and so on. So we just don't harvest from them alone and leave them alone, stranded. They're part of a follow-up, continuous follow-up.
Okay. All right. When we come back, we'll take another break. When we come back, we'll have more for our final segment of Health Matters. Don't go away. Stay with us.
Hypertension, commonly known as high blood pressure, is when the pressure in your blood vessels is too high. It is common, but can be serious if left untreated. People with high blood pressure may not feel symptoms. The only way to know is to check your blood pressure. Consistent blood pressure readings at 130/80 mmHg are considered high hypertension. The first number represents pressure during heartbeats, while the second represents pressure when the heart rests. Risk factors like certain health conditions, lifestyle, age, ethnicity, and family history can increase your chances of developing high blood pressure. By lowering your blood pressure with exercise, a healthy diet, reducing stress, not smoking, and limiting alcohol and sodium intake, one can delay the progression of high blood pressure. For those persons already living with the condition, it is important that you take your medication as prescribed by your doctor. If you feel unwell, have high numbers, or want to learn more about hypertension, visit your nearest health center, and always remember to check your numbers. A message from the Ministry of Health.
You're watching Health Matters. On today's program, we'll be talking about the organ tissue for a program here in Guyana. Laws were recently made and assented to by His Excellency the President, something new to Guyana, and it will be taking lots of sensitization for the ordinary man in the street to grasp as to what will take place. It's quite common in developed countries in North America and Europe. We were told 2 doctors here in Guyana or in Spain to further strengthen their capacity in doing so. Dr. Tanrine Singh is with us. You mentioned something earlier on. And of course, once we try to do good, there's always something popping up, a rogue element, as the case may be. We would have seen in other countries where it has become such a great demand. People, will do things, as we would say in Guyana, under the table. Well, you think the law is going to has elements that will protect people against those rogue elements?
Yes, if you look in international media, you will see cases of where organ transplant is there's a black market for organ
Absolutely.
around the world. And we hear some horrendous stories about people harvesting organs from people unknown without their consent and so on. So this act that we have in place actually takes into consideration those issues and have addressed it. There's like Section 5, Section 6, Section 7 of the act actually deals specifically with those issues of illegal harvesting of organs from person without consent. And there's even a fine, that you can be charged or for persons who harvest organs from both deceased donors or living donors without their consent. And there's several checks and balances mechanisms that they put in place because this is not a one person who decides that you're going to have. It has a committee that is set up, a transplant organ committee. Your name have to be on the register. Before a transplant takes place, you'll have to be, even before we harvest from an organ, it has to go through this committee. The committee makes a decision and then speaks with the transplant team. Then they collect. So there's several mechanisms.
Foolproof system in that place.
Foolproof system that prevent those things from happening. So it's not that one person will actually give the okay. It's an entire team, a committee that will have to give the consent for them to go ahead to harvest, and also who received the organs. So we hope that once that system is fully implemented, things like this that you hear on the international scene doesn't happen, in our situation, because that can really spoil our organ transplant program.
Interestingly, I was told, and I was surprised, that when you hear about organ transplant, you're thinking about mature people, people, old, sick people. They want to use the word old. But recently at the Georgetown Public Hospital, great work was done recently with a pediatric, a child. And so that there is a capacity for that also.
Yes, the transplant team can do both, not only for the adult population, but also for the pediatric population. And as you mentioned, last week we had a kidney transplant for a child. It was very successful. But one of the other things is that we can't harvest organs from children. Part of the act, we're not supposed to harvest organs from a child who is a child, unless it's an extreme situation. And so, but that organ came from an adult donor. But we have the capacity to do transplantation in pediatric population.
Right. The thing is, as this is not going to be something for the near future. Definitely, this is going to be something now implemented for the long haul, and it will have international support, because now we've got Guyanese in the diaspora. So I'm sick here in Guyana. I've got a brother in the States now. All of those things are taken into consideration. Who might want to send his donate from another country to Guyana? Are all those things taken into consideration?
Presently, we're looking at the local situation.
Right.
For instance, donors should be in Guyana at the same time, because it was a very short space of time between harvesting your organs. But for living donors, we have had cases where relatives from overseas came and donated their organs to a relative in Guyana here, and they go back. But harvesting organs from one organ to moving it from one country to another, that is another system we will look at. Because sometimes we might have a donor who might donate all the organs, and we only need the kidney, but there are other organs like the liver and so on that we can harvest from that deceased donor. We are looking at like collaboration with like Brazil. You know, they have a big need. They can use the organs, but we need to get MOUs and so on in place to make that happen. Right now, we are just looking at the local situation so that donors are local and the organs are used within the country for now.
And then, so all systems are go. You were talking off camera that now you're putting a system in place, especially for sensitization. What would take place with that?
Well, over the next few months, you will start seeing ads. We will start putting, these public media messages on the TV, the Facebook place to start sensitizing the population.
And especially how they could contact the agency.
And how they could contact the agency if they want to be a donor later on. What are the forms? What are the things you sign, documents you need to sign up? And so that in case anything happens to you, that you know that this person's already consented. So those are in the next couple of months as we move into the getting the process in place and putting all the systems in place, we will embark on this sensitization campaign. Both media and on Facebook, social medias and so on will be involved. The ministry is presently working on some campaigns to launch the campaign, the media campaign, and sensitize the population so that people are aware and know that this thing is happening and it's not something new. They're asked upon when, they're suddenly asked a relative to donate the organ or so on. People will be aware.
Because it's not something you can...
You could click your finger
and make it happen.
And make it happen.
All right.
You get an accident victim, and then we approach your relatives and say, oh, this guy is clinically dead, but can we harvest his organs? And then we don't want that situation. We want people who are aware that, well, okay, it is okay, go ahead. It's something. So that ease of, because a lot of time it can be really very disheartening at time when somebody declared dead and the family is not aware of this happening. And it can be a very traumatic time. So sensitization, knowing that the process can happen and so on, is good for the population. It's better for the teams too.
Yes, you have heard stories, not in Guyana, but elsewhere, where people, donors, persons who receive from a donor are thankful for a deceased person because, that someone who has died now is able to at least help someone else to live. As case with Dr. Narayan Singh, thanks a lot for being on our program. Quite sure we will have your team to come back to tell us more about the intricacies of donating of organs, and of course by the time then we'll have all of the systems in place to know where, how, when, and so thank you very much for being on our program. Thanks a lot for being with us on Health Matters this week. Do join us again next time. Until that time, stay safe.